Hey, what's going on, guys? Welcome to another video on my channel, Hairliciously. If you guys are new to the channel, please make sure to hit that subscribe button so you guys are updated on hair loss and hair transplant topics. Visit my website at hairliciously.com to purchase your microneedling device, which is scientifically proven to stimulate hair growth, my low-level lace therapy cap, the Topical shampoo and serum, hair growth vitamins, and a few other products for those who are losing hair. So in today's video, I wanted to share with you the results of a guy that I found on the forum Hair Loss Talk, who had apparently been taking oral minoxidil, and to be honest, he saw some incredible hair growth. He would definitely be what I would classify as a hyper responder to minoxidil, and his hair growth was so excessive to the point that he actually had to consider getting laser hair removal. He claims he was taking 5 milligram oral minoxidil for 4 months, and then he moved to the 10 milligram because the pills would break a lot when he was cutting them in half, and so he just started taking them as one 10 milligram pill daily. Typically, most people who are taking oral minoxidil would take doses between anywhere from like 1.25 to 5 milligrams. So 10 milligram for the treatment of hair loss is, not unheard of, but it is a bit on the higher side for dosage for treating androgenetic alopecia. He's also taking 0.5 milligram dutasteride, but he attributes all of his hair growth to minoxidil because he started seeing results only after he started introducing oral minoxidil into his hair loss treatment regimen. And as far as side effects, from what I've read, the only thing that he's noticed besides the obvious hypertrichosis was some dark circles under his eyes. The dark circles, as far as what I know, is due to the effect of the vasodilation that can cause the blood vessels to overdilate, as well as potential collagen inhibition. He didn't seem to have any other issues with water retention or cardiac related issues that some people attribute oral minoxidil to. Now, unfortunately, he stated that he did not have any photos prior to taking oral minoxidil because he was obsessed pretty hard with his hair loss, and he would end up taking photos every day to compare, and basically it was messing up with his mental health. But I actually did find an older photo he shared from a different post a few years back, and here we can see his left temple for treatment. Now, he also did claim that he was previously a Norwood 2, and based on the photo we can see temple recession, but there's nothing too crazy in terms of hair loss. So at this point, he has all of his bases covered. He's on a potent 5-alpha reductase inhibitor to basically block a huge chunk of DHT. And on top of that, he's also taking a growth stimulant orally, which has way better efficacy than topical application. So let's go ahead and take a look at some of the photos that he provided after taking 10 milligram oral minoxidil. He started seeing insane results around the 6-month mark. And right off the bat, we can see some crazy amounts of hypertrichosis that is just going on. Just look at the hair loss reversal on his temple, and he's basically at like a Norwood -10. I think he has so much hair that his temporal points are about to connect to his eyebrows. He also does seem to have thicker eyebrows as a result of taking oral minoxidil, which shouldn't come as a surprise, given that oral minoxidil goes at least 90% systemic and also targets areas in the body that basically has the ability to grow hair. The other temple looks pretty damn good too, and he's literally approaching what I would call a Neanderthal status. Man, just look at that insane amount of hair growth to the point where he might even really need laser hair removal to remove all of the excess hairs that are, on his forehead, his sideburns, his face. And I think this hairline is probably the most juvenile that you can ever get. This is what most men who are losing their hair would dream of. Probably not in terms of how hairy this guy turned out to be, but as far as his hairline recovery from what it was before, I think that anyone would die to have something like that. Nice thick density, incredibly low hairline with no signs of recession, and it's really crazy to see how much of an effect that oral minoxidil can bring about in terms of reversing hair loss. And a lot of times, the efficacy of oral minoxidil is so powerful that even without taking a 5-alpha reductase like finasteride or dutasteride or even anti-androgens that are supposed to target the androgens in the body, you are still able to maintain all of that extra growth, simply from a growth stimulant like minoxidil. The efficacy is so strong that a lot of times it will offset any hair loss caused by androgens in the body. So oral minoxidil is pretty potent, and it can work wonders for those who may not respond well to topical minoxidil. Topical minoxidil 5%, as we know, is very poorly absorbed into the scalp. Less than 99% of the amount that is applied on the scalp actually goes systemic, meaning that the majority of the topical solution is either going to end up on the surface of the skin or it's going to get lost from the surface of the skin to the environment. And there was actually a study titled Topically Applied Minoxidil in Baldness that looked into minoxidil concentrations in blood and with topical minoxidil 5%, there was actually less than 2 nanograms per milliliter after 1 hour of topical application, whereas oral minoxidil, 2.5 or 5 milligrams were in the body 28 nanograms per milliliter and 156 nanograms per milliliter, respectively, after just 1 hour. So you guys can already tell that there is a huge amount of minoxidil that is going inside the body systemically when the medication is taken orally, and this is one of the reasons why people tend to respond better when minoxidil is taken orally. There's additional activity that takes place in the liver itself that converts minoxidil to minoxidil sulfate, and this I think is a crucial component of oral minoxidil that topical application isn't able to deliver to maximize the efficacy for potential hair growth. I talked about this in a prior, more like a recent video where I talked about oral minoxidil, but you guys can also get tested to see if you are a good responder to topical minoxidil. Typically it can take anywhere from like 6 to 8 months to see any growth, if any. So instead of having to go through the hassle of applying minoxidil twice a day on the scalp for the next half year, you can actually take this test that looks at the sulfotransferase enzyme SALT1A1 that is found in the outer root sheet of the hair follicles. This is a crucial enzyme that is required to metabolize minoxidil into minoxidil sulfate because it's minoxidil sulfate that stimulates hair growth. So the test looks at the specific activity of SALT1A1 on the hair follicles, and based on where the threshold number is, you may or may not be a good responder to topical minoxidil. Now, there are ways to enhance the efficacy of topical minoxidil that I also mentioned in the last video. You can try, microneedling the scalp in conjunction with minoxidil 5%, and studies have shown to, increase hair growth by up to 4 times. Typically, the standard protocol is that you would microneedle the scalp once a week at 1.5 millimeters, and then you would apply minoxidil twice a day, preferably 24 hours after. And this is supposed to help stimulate, growth factors, increase circulation, and even potentially upregulate the SALT1A1 enzymatic activity. And for those who are applying minoxidil right after microneedling, you are basically increasing absorption. So, theoretically, the more minoxidil concentration that goes systemic into the bloodstream, the better the results that can be for hair growth. You guys can also try adding in tretinoin to increase absorption of minoxidil, which has been beneficial for some users, and there has been some studies that did show the efficacy of actually using minoxidil with tretinoin. The question then comes down to whether it's actually better for someone who is, not responding favorably to topical minoxidil to go ahead and make that switch to oral minoxidil. We already know that a higher systemic absorption of minoxidil typically leads to better growth, as it is seen with oral minoxidil due to higher enzymatic activity of SALT1A1 occurring in the liver. So, honestly speaking, given that topical minoxidil in itself is absorbed less than 99% of the total amount applied on the scalp, it's basically useless for most people, as it's not going to go systemic in the amount that is required to see good growth potential, with the majority of the topical going to waste. And it's not a surprise that only about like 30 to 40% of topical minoxidil users see decent growth with. So I think a better approach to those who basically are not responders, to topical minoxidil, or people who are not satisfied with the results of having incorporated, after having incorporated microneedling or tretinoin, and this is obviously backed up, by research from oral minoxidil, is to look into perhaps a lower dose of oral minoxidil. I've seen people use as little as 0.25 to 5 milligrams that have started seeing improvement that otherwise would not have seen occurring with topical minoxidil. And I'm not saying that you guys should just go ahead and jump right on top of oral minoxidil, but the research does show that the sulfotransferase enzymatic conversion at the liver will likely maximize efficacy of minoxidil through first pass metabolism, that topical application of minoxidil isn't able to achieve. I personally wouldn't go for the 10 milligram of oral minoxidil like the guy did, just because I think that it might be a little bit too excessive. And given that there is really no set standard when it comes to the dose for oral minoxidil for treating hair loss, I would probably stick with either 1.25 or 2.5 milligrams. Higher concentrations tend to lead to higher side effects, so I think that the optimal dose would be anything under 2.5, maybe 5 milligrams maximum, to go ahead and try to lower the side effects as much as possible. You also have to take into consideration of obvious potential side effects linked with oral minoxidil. I know that anytime that I talk about oral minoxidil, it's a pretty big controversial topic. There was a study titled Efficacy and Safety of Oral Minoxidil 5 milligram once daily in the treatment of male patients with androgenetic alopecia, an open label and global photographic assessment. And in that study, it showed that 30 men were treated with oral minoxidil 5 milligram once daily for 24 weeks, so for 6 months. Efficacy was evaluated by hair counts, hair diameter measures, photographic assessment, and self-administered questionnaire. Safety of the treatment was closely monitored by means of physical examination and laboratory investigations. There was a significant increase in total hair counts from baseline at weeks 12 and 24. Photographic assessment of the vertex area by an expert panel revealed 100% improvement, with 43% of patients showing excellent improvement. Frontal area also showed a significant response, but less than that of the vertex area. Common side effects were hypotrichosis, which was in 93% of patients, and edema, 10%. No serious cardiovascular adverse events and abnormal laboratory findings were observed. So the conclusion was that oral minoxidil 5% milligram once daily effectively increased hair growth in our male patients with androgenic alopecia and had a good safety profile in healthy subjects. However, oral minoxidil should be used carefully with men who have severe hypertension and increased risk for cardiovascular events. Now, another study titled Oral Minoxidil Treatment for Hair Loss, a review of efficacy and safety. A total of 17 studies with 634 patients were found discussing the use of oral minoxidil as the primary treatment modality for hair loss. Androgenic alopecia was the most studied condition, but other conditions included telogen effluvium, lichen planopilaris, loose anagen hair syndrome, monolectrix, alopecia areata, and permanent chemotherapy-induced alopecia. Conclusion was that oral minoxidil was found to be an effective and well-tolerated treatment alternative for healthy patients having difficulty with topical formulations. So the general consensus is that the oral minoxidil at lower dosages, 5 milligrams or lower, appear to be well-tolerated for most people that are taking it, and most sides go away after cessation of medication. But I do have to also point out that a lot of these studies that you find are relatively short-term studies, and with potential issues like cardiovascular problems that was brought up in the study as potential side effects. These are things that can actually affect an individual long-term. So you have to determine if the benefits are going to outweigh the risks and really assess and make that determination to see if going oral route is worth it. And with any current hair loss medication, this has to be a lifetime commitment. The medication works well, and for those who may want to take it up another notch or potentially increase hair density to the extent that topical minoxidil isn't able to achieve. So that's basically my take on oral minoxidil. I think the guy that I showed you in the beginning of the video who had just crazy amounts of hair growth probably was one of the best that I've actually seen. And I'm fairly certain that as long as he's able to continue taking oral minoxidil, he will basically stay at a normal zero until he dies. Now, as far as trying to obtain oral minoxidil for hair loss treatment, it's obviously not FDA approved for androgenic alopecia, but it is for hypertension, and doctors do prescribe Lonaten. But if you guys are trying to get it for androgenic alopecia, there are doctors who are not going to prescribe it, and at the same time, there are doctors who will prescribe it off-label. Kind of like what they do with dutasteride. It's not FDA approved in the US, but they do still prescribe off-label for the treatment of hair loss. You just have to find a doctor that is willing to do that. And I think once you, typically tell them that topical minoxidil isn't effective, there may be a good chance that they may give you a lower dosage prescription for oral minoxidil. Other people get it from the gray market, but anytime you're getting medication without prescription verification online, I think it's always going to be a gamble. But that's pretty much it for this video, guys. Let me know if you guys enjoyed this content. If you are also taking oral minoxidil, let me know what your experience was, and make sure to share them in the comments below. As always, thanks for watching, guys, and stay tuned for my next video. Take care.